So we look at, we take this further and we look at the feminist view and body integrity. And one of the things that we look at is objectification of the female or can apply to her patients as well. But how the patient, she takes on a patient perspective to a normal bodily function. And Amali's also been involved in something called Footprints, which talks about the woman's own views of what they experienced in maternity care that might not be recorded elsewhere. And there's a few women in there that actually talk about how they've gone along with something that they're not actually agreeing, because after all, they're the patient. It's almost as if they're giving up their body to the system rather than actually having true consent in the decisions they make. So these are some of the factors that we consider. We also look at Montgomery versus Lanarkshire, and this again emphasises the importance of this is in 2015, and it was a case where a woman would have had a caesarean section if she was aware of the risk of shoulder dystocia. That's the shoulders getting stuck at birth. Because she's diabetic, and there's a 10 to 15% chance that she could have had shoulder dystocia. But she wasn't told, because she was the obstetrician said, well, if I told her or told other women this, they would have gone for a caesarean. But it wasn't the obstetrician's right to make that decision, and too often there is paternalism in that we believe we know best. After all, we've got all this knowledge, we know better than you, and actually we're caring for you. This is important for you. This is why we're providing care.